Welcome to Insights on Innovation for Self-Insured Employers. It's a series that Matter produces together with Trustmark. I'm Stephen Collins. I'm the CEO of Matter. We are a healthcare technology incubator and innovation hub built on a premise that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. Today, we are here to discuss the evolution of virtual care. About 40% of consumers say in surveys that they believe telehealth will be a part of their healthcare journey in the future, compared to just 11% prior to the pandemic. And 60% of physicians view telehealth more favorably now than they did pre-pandemic. The shift to virtual care that's been accelerated through the pandemic presents a set of challenges and opportunities for self-insured employers and employees. And we've got a great group with us today to discuss what's on the horizon. Paul Scaglione is the Chief Growth Officer of Trustmark. Before joining the company last year, he spent 22 years at HCSC, most recently overseeing strategy, innovation, and delivery of market solutions for their large national accounts. Janet Faircloth is Senior Vice President of Health Innovation at Aon. She's been with the company for 30 years and is focused on the development of next generation healthcare and benefits strategies. Rob Bressler, Senior Vice President and General Manager of Primary Care at Teladoc. He joined the company in 2013 and is responsible for the overall direction of their primary care solution. Our moderator today is Christopher Paquette, who is the Chief Digital and Strategy Officer at Trustmark. Christopher was a partner at McKinsey before joining Trustmark last year to lead their digital and analytics strategies. So with that, Christopher, let's get started.
Sounds great. Thanks, Stephen. So I'm really excited about this topic today, and I know our panelists are as well. Thanks everyone for joining. And let's dive in. So I think we'd be remiss to talk about a solution without understanding the context. And so Janet, maybe you can start us off with explaining some of the macro factors that you see that are driving changes in innovation and healthcare and employee benefits today, and how those affect virtual health. What are you seeing from your role?
Yeah, thanks, Christopher. I think when we look across the landscape of everything that's happening, we really see 5 key forces that we believe will be shaping the future of benefits, and they increasingly have urgency for employers to address when we're in this really tight labor market, at least in the short term. So the first one is that employee expectations are expanding, and it's natural as the workforce is becoming more diverse. Work models are evolving, and there's more opportunities for remote and flexible work. So we're also seeing that a key expectation among employees coming out of the pandemic is that their employers will support them with their entire life experience and not just their work life. The second factor is that unfortunately health and well-being is declining. It's another legacy of the pandemic, that employee well-being has really taken a big hit, but at the same time, employers are really seeing that connection between healthy and resilient employees and the performance of their business. So a bigger focus on really improving health and well-being. Third one is the focus around DE&I. It's a priority for most CEOs if you look at surveys, and employers are really increasingly focused on how they can assure that their benefits programs are also advancing their DE&I goals. When we're talking about declining health and well-being, the data is really showing that it's really been worse for young people, for women, for people of color. So health equity is definitely one of those key areas of focus. The fourth factor is the affordability pressure. I mean, we've been talking about healthcare costs for years. It seems like the trend numbers never actually changed that much. And unfortunately, a key strategy for employers over the years has been to cost shift more to employees, but we're really reaching a point now where the cost of healthcare for employees and their families is becoming increasingly a barrier for them to getting the necessary care that they need. And then finally, there's a bright spot in all of this, that there's a significant amount of market innovation, and we'll be talking about some of that today. So there's new solutions from startups as well as from traditional market players to address some of these challenges. And so really, when we think about virtual care, the collective effect of these trends is to really broaden the lens on the ways that virtual care can support an employer's benefits and workforce goals. We're really are at this point now where we can start to move away from thinking about virtual care as just another like cost savings tool, and think of it more as a way to help address this variety of complex challenges that I was just talking about. We think about it in the context of a new solution like virtual primary care. It can really address all 5 of these factors. It meets that increasing employee expectation to be able to do everything from anywhere. It helps improve, employee health and well-being by having them more engaged with primary care on a longitudinal basis. It can advance health equity by filling in gaps in access to quality health care and the cost of care, lowering costs for employees and employers. And it can really be a tool to leverage that market innovation I was talking about by using the technology that's inherent in virtual primary care to integrate new solutions that are important to employers into care delivery.
Yeah, well, great answer. Thanks. It's clear that there's a lot going on that's shaping the market, driven by pandemic and other trends in DEI and cost and innovation, that you've just talked us through. Rob, if maybe we just for a minute took kind of a double click on the employer lens, in your front row seat at Teladoc, like what are you hearing from employers? How do they think about these types of trends? How do they think about virtual care as a solution to them?
Sure. Thank you, Christopher. And good afternoon, good morning, everybody. I think Janet gave a great setup there, and Christopher, as you said, maybe I'll double click on that a little bit. To emphasize Janet's point, obviously nothing novel, that it all sort of centers around and comes back to access, quality, and cost. But what we're seeing is this really exciting evolution where the scope and the responsibility of virtual care has expanded so dramatically, especially over the past 18 months as folks have become more aware and there's more investment in the space. So it's gone from a space where you've had some point solutions solving urgent care type of needs in certain circumstances, going a little bit broader than that. But of course, as I said, in sort of the recent period, the scope and the depth of what virtual care can really address has increased by an order of magnitude. So virtual care has, from an employer's perspective, become a really material investment and something that requires like a proper strategic thinking, a proper plan as they really begin to blend together the virtual offerings with the bricks and mortar offerings that they put in front of their beneficiaries. More specifically, I guess I'd highlight, in the face of that, 3 key trends that we're really, watching and 3 things that we're really building our solutions around. The first is, if I think back to past 5-10 years ago, as you said in my introduction, I joined Teladoc in 2013. So I've had a front row seat to this evolution. We've gone from a few players in the industry to literally a few hundred. So the need to really have a sole source, single source for both the purchaser and then how that gets passed on to the user is really critical. It's easier for the buyer to manage, but it's also easier, frankly, for the end user to navigate when it all sits behind that one single front door. The second theme that we're going to talk a lot about here today, and something that I'm really passionate about as we think about primary care in particular, is that there is no standalone bricks and mortar model, and there is no standalone virtual only model. We believe that will be truly successful. We have to create a hybrid ecosystem where an individual goes sort of seamlessly, in a frictionless way between those different touch points, and makes it such that those vendors or that sole partner are really working closely hand in hand to break down as many of those barriers that create kind of friction for the individual as possible. And that's a theme we'll talk about a lot more today. And then the last one that I know that obviously this group is collectively very excited about, and something that we're seeing as a really macro trend in the market, is that benefit design and the vehicle, the benefit product, the carrier product, needs to work even harder for the employer, for the member, and the ways in which virtual care is really being embedded into that offering. The stat I'm going to give here is not a Teladoc stat. This is a third-party statistic, and that is in the coming year, about 15% of mid or large employers will offer some version of a virtual first health plan, and another 20% are looking at that to at least offer in the relatively near term. And that kind of, to bring it full circle, points to the fact that obviously there's a belief that it's going to expand access. There's a belief that it's going to drive down cost. And it's, overall going to ultimately drive better quality and better outcomes, because we're really, delivering expanded access to prevention and wellness and all of the benefits that come with primary care. So really excited to talk about those 3 themes today. And Christopher, I guess I'll pass it back to you.
Yeah, thanks, Rob. Paul, what's your perspective on this? I mean, you spend a lot of time, with employers, of course, working through some of these needs and their trend, reducing friction for employees, making the benefits work harder for employers. But maybe to that you could add the employee lens as well, and that's something that you touched on also, Rob. Like, this just isn't about employers; it's about better healthcare. It's about reduced friction. It's about improved outcomes. Like, how are you seeing it from your seat, Paul?
Yeah, thanks, Christopher, and good afternoon, everyone. So yeah, in my role, I have the opportunity to talk to a variety of employers, some very small, some medium-sized, some very large employers. And I would say, just kind of build on what Janet and Rob was saying, kind of from that employer lens, it really is around kind of how do we bend that cost curve. They are, I think, at a point of frustration of seeing those 6% annual increases on the impact to their bottom line or their benefit spend. And I think every employer is unique. Some are very paternalistic, where they've kind of absorbed those costs and they just want to do that as part of their company culture. Some are very cost conscious. Some are innovative or looking for solutions. But at the end of the day, what's first and foremost in their mind is, how do I bend that trend? How do I reduce my employee costs? But that's coupled with some of the things that Janet and Rob talked about, which is kind of what's happening in the market, or what's happening kind of more at a macro lens, particularly around the ability to attract and retain employees, right? We're all, I think, kind of going through this great resignation here, and benefits are a big component of that. So they're looking at, how do I get the most out of my benefits to retain the employees I have and track the ones that I really want to help me drive my organization. The other thing I think employer groups are looking for is they want their employees to use their benefits appropriately. Employers spend a lot of money. It's usually the second, third on their balance sheet in regards to costs, and they spend a lot of money, bring a lot of solutions to the table. They want their employees to engage, and when they engage, they want them to use the right care in the right setting. And then, as Rob mentioned, I think employers are looking at kind of the solutions that I bring forward for my employees. Does that encompass whole person care? Is they really direct to point solutions, or is it managing my employees' overall health and well-being? And particularly at this time, behavioral health is a significant component of that. And so when I think about the employer needs, and I also kind of put a lens on the employee needs, I think they're pretty much aligned. I don't think they're very far off. I think the big difference is when you think about the employee, and I'll even say I'm guilty of this myself, is typically the employees don't engage until there's an issue, until there's a health issue, until I need to use my benefits. Then all of a sudden I become very interested in what has been offered to me. So that's always a challenge, is to drive engagement, drive adoption. But at the end of the day, what that employee is looking for is similar to the employer. They want low cost. They want low out-of-pocket expenses. Most don't kind of budget for those unexpected medical expenses. So they want their healthcare at a minimal cost to them. They also want convenience. Everybody's very busy, leads very busy lives. We're all working very hard. They want to be able to access the healthcare system conveniently. And they want the security. They want the security to know that their benefits are there to protect them, so they have that security. And then also, as I think about the employees, and I kind of put, again, my own lens on this, I think more becoming comfortable using virtual care. I even, again, myself, over the last couple of years, I'd say the vast majority of my care has been virtually. And I think employees are becoming more comfortable not having to go to the bricks and mortar, not having that inconvenience of doing that. So that's kind of how I see that kind of employee lens, Christopher.
Got it. Thanks, Paul.
Mm-hmm.
Hey, you guys have done a great job setting the table. What are the trends? What do employers care about? How employees think about it? Attracting and retaining employees, reducing medical costs, reducing friction. Some of the trends, Jan, that you've talked about with health and wellness, DEI, innovation that's happening out there. I think that's a really rich perspective that we should all keep in mind as maybe we turn our attention a little bit more towards the mechanics of virtual care and how we think about the specifics of some of the solutions that are out there now. I think Rob, it was an eyebrow raising statistic. There used to be a few, now there's a few hundred. So tell us a little bit more about that market. It sounds like there's definitely some complexity there. What are the different types of virtual care? How do we think about the solutions and what's available?
Yeah, there really are, Christopher. It's been just sort of anecdotally, I think back to when the Teladoc, for example, went public, and I think the industry is probably doing more visits in a couple of weeks than they were doing in a given year or a handful of years back in about 5 to 10 years ago. But it's just been obviously a really, really exciting evolution to see the awareness and the engagement begin to pick up. But to answer your question more directly, the framework that I think about when employers sort of ask me where to start, it's my first entry point into virtual care. I'm trying to get better educated. We try to paint a picture for them that has a mental model where there's sort of two different dimensions. The first dimension is really like the way in which the care itself is delivered. And I'll unpack that in a second. That's one spectrum from sort of like lightest touch to most engaged. And then similarly, the other dimension is how is the care sort of offered? What's the benefit wrapper? What's the packaging? How is it served up to the individual? So first on that spectrum of the care delivery, I think that you could put it in probably 3, if not 4 different buckets. And I'll start on the left side and then I'll talk about that other axis here in a second. So, the leftmost side, what I say is like the lightest touch, easiest to implement is that text-based or messaging-based approach. It solves problems for large populations. It's quick, it's easy to access. It's by definition somewhat narrow in scope just because of what you're able to address, and at certain points lack of integration with the overall system, but as a really kind of quick hit, low priced way to go ahead and deploy one virtual care offering for an employee base. The second step along that evolution I'd call the virtual only models, and this might be the way that some folks think about kind of the legacy telehealth telemedicine space, where yes, it goes beyond what text-based can handle because you've widened the aperture of the medium. So you're using video, you're using phone, you might be making some referrals here and there, sending a medical record here and there. So there's some level of integration with the broader system, but it's still, as I described, a virtual only model. And we're seeing the emergence of a handful of those, but frankly, some players really pivoting out of that and recognizing they need to be more deeply integrated with the broader healthcare system. The sweet spot and the one that I really believe in, the one that we're focused on is this hybrid model. Again, back to that earlier point, that's the third stop along the evolution that I'm describing. One where the user, aside from knowledge of where they're physically located, doesn't even really think about, am I having a virtual visit or am I having an in-office visit? The cliches and all those kinds of things, the comparisons to banking and otherwise have been drawn in our industry 1,000 times, so I won't repeat that message, but it is that same evolution and really getting to a point where a consumer is not saying this is physical care or this is virtual care, it's just the care that I need at a given time. So that hybrid model really feels like a sweet spot for us and is the model that's probably most interesting to me. And then the last stop, of course, is what I'd call sort of legacy bricks and mortar providers who have historically delivered care inside the 4 walls of a facility and are trying to pivot dimensions of their business model into how do they deliver virtual care to their patients, expand their patient populations and otherwise. The other axis that I described, like I said, is how is it packaged, how is it delivered? And for our audience, I would say think of a spectrum that is, there's the ancillary lightest touch can be deployed to an entire population approach, or there's a virtual first health plan all the way at the other end. The ancillary benefit being easier to deploy, of course, because it's agnostic to underlying carriers. It comes at a lower price. It doesn't have the same level of integration. And then if you push that to the other end of the spectrum, which would be a virtual first health plan, it's something that a consumer actually chooses at open enrollment. It's integrated with prior auth and prior cert and all of those things that need to happen within a complex health plan environment. And one is not necessarily right or wrong along any of these two different spectrums, but I'm just trying to paint a picture that maybe will frame the conversation today. So to put sort of a concluding point on that, as you called out my observation there that we've gone from a few options to a few hundred. We really encourage prospective purchasers and our partners to think about where they want to land on this matrix that I'm describing, because obviously, every group is different and every group has different needs, but that's a good starting point, I think, as a mental model.
Yeah, that's super helpful, Rob. One of the questions is actually coming through the Q&A is about how some of these models on the couple of dimensions that you've outlined could potentially help broaden the types of solutions or conditions or interests that are being addressed. So I'll just read the question. Traditionally, they've been focused on conditions such as diabetes and musculoskeletal. How is virtual care, or will virtual care help broaden the employer's interest to include other high-cost conditions like cancer or others like that? So, I guess that's for all 3 of you. How do you think about that?
I'll go first, maybe because my comments precipitated the question, and I'll let Janet and Paul add on. A couple things. I come back to what I said at the outset, right, which is just the depth of what we're able to do clinically nowadays will, by definition, Christopher, I'm understanding the question correctly, just expand what we're able to address, whether it's gathering data in the home, whether it's using AI and NLP to understand where someone is along the acuity or where they are in the evolution of a given disease, just like what the information we can gather foundationally just makes it such that we can address a broader range of conditions. And sort of to build on that theme, the more we can put that in one single place for the consumer so they don't have to think about, do I go here for that and then there for this? It all just resides behind that one front door is going to make things much, much easier for them. And then I guess my other comment is something that's been really critical to me and to Teladoc. We've been building out the primary care solution is it cannot be agnostic to geography and where someone is located in such a unique way that didn't exist previously. We're really focused on making sure that the person who's in like the far-flung rural corner of somewhere in America has the same exact experience as somebody who's sitting in Los Angeles or New York or what have you. The contributions that has to health equity and the care that a person can now get that they didn't previously have access to is just really, really meaningful and something that we see as really exciting as the frontier of what primary care and virtual care can do in this context. Janet, Paul, I'll pass it to you guys to see if you have anything to add.
Yeah, your last point, Rob, was one that was going through my mind. I think the next wave that we'll see in virtual care will become this like highly specialized solutions and, being able to, fill in gaps in access. So something like providers that, are sensitive to LGBTQIA community needs. Those providers don't exist everywhere, but through virtual care can be brought to everyone across the country. So, I think more and more we'll see those highly specialized needs being addressed in virtual care just because of the lack of access. Otherwise, just, is pretty acute in some cases.
Mental health is another big one that we talked about before as we were, comparing notes and preparing for this. It's a question that's come up in the Q&A as well. How do you think about virtual capabilities expanding route to care for mental health as well?
Well, the headline, obviously, Christopher, I think you're directing that to me to start, or others interrupt. Similar to what I was saying with respect to primary care, any other provider types, obviously that's a place where we've got some of the most widespread shortages, and especially in rural areas where you've got people literally traveling hours previously to see a therapist, a mental health provider, or otherwise. But it's not actually just the access to the care at the time of need, it's the awareness of even arriving at that point to begin with. So putting an emphasis on screening for mental health, making it a part of an individual's journey to better manage their own health. As I was sort of alluding to, the information we're able to gather now by driving the engagement and awareness with using new tools and technology. I mean, we've seen some really cool stuff of like NLP and AI and otherwise that are essentially diagnosing mental health needs fully remotely. The reach of those technologies and making it such that someone no longer has to drive to a psychiatrist's office just to get necessarily a diagnosis, for example, is really, really compelling. And the ways also in which these are being integrated with the broader suite of services. So if I find out from my virtual PCP as an example that I do need a mental health visit, for example, and I can have that same visit from the comfort of my own home, is just going to broaden the ability of individuals who have that need to access that just dramatically easier than they could have previously.
And when I think about kind of the offering, particularly around the virtual first kind of health plan, it really, one of the key benefits of that is kind of what Rob is mentioning. It's really that care coordination. It's entering the healthcare system. So whether I have cancer, diabetes, mental health, oftentimes people are a little hesitant or concerned or have anxiety around that. They don't have that doctor in the home to guide their care. Through these virtual first health plans, they have somebody to guide that holistic kind of view of the healthcare system, have their information to guide what's personal to them, to help them through that journey. And that is critical. Again, whether it's these chronic conditions, whether it's behavioral health, whether it's just getting them to the right physician, those that are high quality, low cost physicians. I think somebody being an advocate for that employee or for that patient helps with that journey and helps with our health outcomes.
Terrific. It occurs to me, all these solutions are great, but they matter not unless people actually adopt them.
Okay.
And so, this is not a new thing, but it's a newly growing thing, at least as rapidly as it has been. And the pandemic created some shocks for adoption, of course, and maybe one would expect as the world returns to a little bit more normal that we'd see some decrease in usage. But Rob, from your chair, and you too, maybe Paul, like how do you think about employee adoption of these solutions? And then there's also look different the older population that you're a little bit less digitally savvy or not so much, or how do you think about adoption for the different segments?
Sure, I'll go first, maybe Paul, then I'll pass it over to you. I've got to actually sort of tie these two things together based on your comments there vis-a-vis mental health. But Christopher, you hit on obviously one of the key themes that the silver lining of the past 18 months during COVID has really brought about enormous awareness, engagement. I would even say, consumer expectation that this be part of their care and be part of a benefit offering in the future. So what we really put an emphasis on is driving that top of mind awareness at a point of need. As Paul was suggesting, oftentimes the challenge with healthcare, someone doesn't think about it until they need it. But by stitching things together in a single solution, that same front door, and driving many touch points with the consumer throughout the year, there is that top of mind awareness that sort of comes with that surround sound feeling of engagement. We're doing that based on a number of different data points that we might have around an individual. So if they're a frequent flyer to the ED, if we know, for example, they don't have a PCP from their claims data as another example, there's different messaging that needs to be highly personalized. It's not going to be a blanket approach, obviously, that's going to work for all. Just maybe two other quick comments, and one of these I'm going to sort of, like I said, tie back to what Paul said there, is that the benefit design is just so critical. We're all obviously talking about cost here, lowering it for the employer, but also passing on some of that saving to the end consumer. We're seeing in consumer research, obviously, that there's a great degree of interest in lower price plans and certainly a willingness to accept virtual in order to do that. But if I think about an example of mental health, if my PCP tells me, Rob, you need to go see a therapist, psychiatrist, or what have you, oftentimes the barrier for folks is just simply one, I can't find one that's available, but also my benefit design makes it such that that's prohibitive for me to go and do that. So top of mind awareness is great, but if it's still structured in a way that's prohibitive for someone, that's really challenging. So making the benefit design and making the vehicle in which it's delivered work for engagement is really a critical focus for us. And Paul, I know that's something you and I have talked about frequently, so I'll let you add on and see if you have any comments from there.
Yeah, thanks, Rob. So thinking about engagement and getting employees to utilize those benefits, as we said, that's always a challenge, right? So to get people to be interested in their healthcare throughout the year, not only when they need it. I think every employer is faced with those challenges. And so really it's about how do you improve on that? How do you increase that engagement? So recently we had conversations with a large employer that offers a solution, and they were chatting with us and questioning why people weren't engaging. And we asked them, what was their communication strategy? How are you getting the word out to the employees to use this benefit? And the answer was, we put a flyer in their open enrollment packet once a year and hope that they drive that engagement. And so I think the employer groups, the HR departments, in partnership with your health plans or your point solutions, really need to have kind of an active marketing communication plan to drive that engagement. And it has to be multi-channel, right? So we all rely on our cell phones, but when you look at the spectrum of employees at an employer group, some are comfortable with it, some don't want to engage with it, some want to engage via email or mail, and some want to kind of be pinged by their HR department, some don't. So you got to look at it kind of multi-channel. And the last thing I would say to kind of drive that engagement is data. So data obviously is king, right? So looking at the data, looking at gaps in care, sending push notifications out to employees to drive that engagement will help. Again, I don't think it solves everything, but having a strong communication plan to drive that employee engagement will help with the engagement, will help with the outcomes. Janet, anything to build on there?
Yeah, I think, Rob mentioned earlier the idea of having a front door to care, or, we talk about it, that everyone needs a health home front door. Like, where's that one place to go? And the more that is a clinician, I mean, the research will show that people are most likely to follow the advice of their, primary care physician and care team versus employer or anyone else. So to the extent that you can, sort of move that upstream to where care is being prescribed, whether that's through a variety of strategies that sort of wrap around that front door to care, I think that will be more and more the future of how employers will work to engage their employees.
So we're already kind of hitting on this topic, so I'll just ask the question frankly. Like, if I'm a self-insured employer, sitting in the participant group now, like, how do I think about evaluating these solutions? One that reduces cost of care, one that engages my employees, one that delivers better health outcomes. Like, all that sounds great, but like, if I actually got to go do that, like, how do I think about evaluating those? Paul, Janet, what do you think?
Sure, I'll start, and Janet, feel free to jump in. So I have had experience kind of managing a suite of point solutions in the past. And as Rob said, there's thousands of these out there. And I know a lot of them are calling the employer groups, trying to sell their wares. And it's hard for that employer to go, which ones add the most value? Which ones are really going to help me? And so as an employer, the advice I would give to them is, certainly look to understand the value you're getting for what you're spending on that. Is it impacting the healthcare spend? Second, is it improving the health and well-being of your employees, or is it causing confusion? Think about the overall member experience. Do I have to call one number for musculoskeletal and call another number for behavioral health and another one for diabetes? Is it really adding value? And then last, kind of what we hit on a few times, is it convenient? Can I do it digitally? Can I get access to it right away? And then the last thing I would advise employers is really around reporting. Can I get the data? Can I get reporting from these solutions that I can really evaluate to see if I'm getting the return on investment? Is it driving that engagement we talked about? Is it improving the health outcomes? So that's kind of how I would advise employers looking at a variety of solutions.
I think that's a really great framework, Paul. I probably would just add a few things maybe upfront and at the end. So upfront would be really being very intentional about, what problems you're trying to solve with the solution. So what does your data say? What are truly impactable problems? And then are the solutions actually proven to have an impact on the problem that you're trying to solve? Lots of solutions out there saying they can do all kinds of things, not a very small subset who actually have proven results in doing it. So, intentional focus on solutions to, problems, finding solutions to problems that can be solved in an impactful way. And then, we've, Rob mentioned like hundreds of vendors out there, and I think more and more for employers, they're working with multiple different vendors. So it's not just your relationship with each individual vendor, but how do they work together? Mm-hmm. Are they sharing the data and willing to share data in a way that lets you accomplish your goals? Are they willing to enter into shared performance guarantees around results, because each of them sort of are hitting a piece of the problem? So really thinking about an ecosystem holistically rather than each individual vendor, and selecting vendors who are willing to participate that way.
I love it. I love that we're talking about data. I love that we're starting to talk about the benefits and the results. So it's a great place to go. Like, what are we seeing in terms of outcomes so far? Rob, on the individual side, like, what kind of health outcomes, what can you point to with some of your data? Paul, Janet, from the employer perspective, what kind of cost savings are we seeing? There's a great question that came in of, total healthcare spend that's out there right now. What % of that do we think that we can really address? Like, brag a little bit, but also point towards the future, because I'm sure there's even more that we can do. But where are we today? What are we seeing? What are the results?
Sure, Christopher, I'll take sort of the first parts there, and then chime in with the rest of the group. Jen, I really like that you sort of pointed to, like, what are some of the macro goals of an organization that they're trying to solve? Because if I go sort of like the highest order, challenge that we're trying to solve, it's, matching number of individuals who don't have a PCP relationship today. What's the effect that we're having on expanding access to prevention, wellness, all the benefits that come with primary care? It's a bunch of dimensions and measures that come after that, but some really, headline things that we're looking at, because obviously that all bubbles up to the impact on quality, cost, access, like we've been talking about here. But more specifically, so some of the things that we're watching closely, measuring, one of those headline numbers, as I said, is what percentage of the folks in our program, our members, are coming to us who don't have a PCP relationship, haven't been to a PCP in the past 2 years, have maybe been a high flyer at the emergency department, might be using the urgent care, as their physician in a good case, or frankly haven't had any interaction with the healthcare system whatsoever. So, chronic disease is going undetected, mental health needs are going unmet. So we're really closely watching both through, member reported data, as well as looking at, claims and other information when available, just to see really how we're impacting populations that don't have PCPs. A couple other things to watch, really closely, in ways to frankly, evaluate the effectiveness of programs is, speed to access, and not obviously just for like an urgent care need, but we're all well aware of the pervasive problems with both primary and specialty care and the wait times just to frankly become a new patient in a PCP practice. We're truncating wait times down from what can be 30 days on a national average to guaranteeing new patient PCP availability in a matter of days. Never mind cost. That dimension of just time to the visit is another barrier for individuals. So ensuring that the solution is not just virtualizing the problems that we have today, but actually bringing forward new solutions that advance and break down those barriers in a meaningful way. And the results of that, Christopher, we're really excited to see that that's already playing out. For example, we're demonstrating early detection of chronic disease. About a quarter of diabetes and hypertension diagnoses that we're delivering are first time for the members. So that really shows obviously the effect of getting somebody in who doesn't have a PCP for appropriate levels of prevention and screening. And that sort of all bubbles up to the really fantastic member satisfaction results that we're seeing from our consumers. I love reading the anecdotes and the comments from the members who are suggesting, this is the way I want to see the physician in the future. This is the best PCP relationship I've ever had. These are all different dimensions of access, quality, and cost, like we're talking about here, and are very much in the early innings, but really excited to see the wide scale impact that the bringing forward the benefits of primary care and whole person care are going to have in the models that we're talking about here.
Yeah, I think some of the things you touched on, Rob, around, sort of the impact on access, on health outcomes, all important things to measure. And then, Christopher, it sounded like in your question, there was woven in there around cost, which, I think often when we're looking at these solutions, we're trying to measure a very elusive measure, which is what didn't happen. So, how do we know that, cost that would have been there otherwise didn't happen? It's rare that it's actually lower than it was the year before. It's less than what trend might have been. And we've done some really great, I would say, very pioneering work around matched cohort analysis to really compare like identical populations to each other. And did, the solution then actually have a difference on the health outcomes, on the per member per month costs, really sort of more isolating, and digging deep into the population to really understand those differences. And we have seen across different solutions that we've measured, a mental health solution, a navigation solution, that, when done well, they are making a difference across multiple of those measures. But again, it gets back to my point earlier around selecting partners. Do they have the proven results, and is it actuarially sound in terms of how they came up with those results? And third-party validated studies, those types of things are what employers should be looking for when they're selecting partners.
Oh, what would you add in terms of the benefits that employers are seeing?
Well, I look at it from the lens of, and I certainly don't mean this to be a commercial, but we announced a partnership yesterday with Teladoc around kind of a virtual first health plan, my virtual care access. And just looking at it from that lens on if we drive the engagement, drive the employees to receive their care virtually, incentivized through the health plan, using the benefits of that to get employees to, when they need to use bricks and mortar, to those right physicians, lower cost, high quality physicians. We have seen when we've evaluated kind of this offering to some of our employer groups that the savings is significant. Again, there's different options you could do in plan design to drive that savings, but we've seen that savings go from as low as around 10% overall spend saving is to high as 30%. It's going to vary employer by employer, but when you think about an employer's spend, even 10%, even 5% is significant. And again, it hits that bottom line, what they're trying to improve, and it improves their health outcomes. It's easy and it's convenient. So I kind of look at it from that lens of where I started with the employers frustrated with that 6% increase every year, move to this hybrid model of virtual primary care wrapped with national networks with a comfort to go to bricks and mortar. This hybrid approach does impact spend.
Yeah, and for the more progressive employers, maybe there's those among the participants who have been embracing some aspect of virtual care for at least months, maybe years and years now. Like, how would those more progressive employers think about a virtual first offering? Maybe not virtual only, but virtual first in this context. Like, where's the innovation gonna happen, and like, how do they think about where the puck's going?
I guess I can jump in on that one. So there's been so much in the press, even in the past month, about virtual first. But there's a lot of ways that can play out. I think so many of the plans that are being introduced as virtual first really are, there's a virtual primary care physician embedded as a network provider. And if you use that physician, you pay less. But it's not really a, virtual primary care is the front door to care that we've been talking about that then guides the individual through, the rest of their healthcare journey. So, when we're thinking about like what's the ideal of a virtual first solution, and the things when we talk with these factors with employers that we work with gets them pretty excited. It is that truly a front door to care, starting with virtual. That then that primary care physician and care team is invested in helping that individual navigate the rest of their care, as Paul said, using cost and quality data to refer to best providers when in-person care is needed, taking care of their needs virtually, having, really investment in the longitudinal care of the individual, that, they're looking at improving health outcomes over time, having a care plan in place. And then really importantly, having a different type of payment arrangement, fee-for-service payment arrangement in this environment does not encourage all the types of things I was just talking about, the care coordination, the referral oversight, the longitudinal, staying engaged with an individual, monitoring their data, keeping track of what's happening with them, and reaching out when appropriate. So it really needs to be a shift away from, a fee-for-service to more of a value-based arrangement that reflects the additional investment in primary care that needs to be in place for that type of model, but then also has responsibility as part of that for improving health outcomes and lowering costs.
And this follow-up might be for you, Janet, or maybe it's for you, Paul. But as you think about virtual care, what complications or maybe benefits, probably get a little bit of both, do you get when you begin to combine with traditional network design? And then specifically, how do you think about reference-based pricing combined with virtual care? What idiosyncrasies arise from that combination?
Do you want to take a crack, Janet? I'll build on your thoughts there.
Sure. So, I think there's different ways to think about virtual care. One is, I was talking about a model where primary care is sort of embedded in the network, but each time somebody needs care, they can decide, am I going to have a virtual primary care visit? Am I going to go in person? Am I going to self-refer to a specialist? So that's a different model, but in that model, it's sort of available to everyone, who's in that plan. The other model is, it's a plan that's offered at annual enrollment, and employees choose to enroll in it. And I think as we've talked about that with employers, a lot of excitement about, a really differentiated approach that can be an attraction and retention tool, and also a way to offer a cost-effective alternative to high deductible plans, but also the worry that just like we saw when we introduced high deductible plans 20 years ago, it was the young, healthy people who enrolled. And, if that's the case, then do we sort of accomplish our broader goals with it? So I think, really taking a close look at the population, demographics, is it a fit across, a variety of individuals, and having a plan design that's going to encourage a variety of people to enroll, those with chronic conditions that they see that it's cost effective for them will be more, likely to enroll in it. And Rob, I think from some of the research you've all done, you've seen a pretty broad cross section of consumer interest in that type of plan. So not just the young healthy that, we might anticipate would be the first to enroll.
Yeah, that's exactly what we've seen, Janet. And it comes back to what's it going to cost me? How am I going to be able to access the providers that I need? And does it create any disruption in the existing relationships that I have? And, in the solution that we've, partnered with Trustmark on, that Paul was alluding to there, this kind of gets back to that notion of packaging, both in solving the problem for the employer of only having to manage a sole source, single point vendor versus, many others, and a vendor, frankly, that solves a lot of those problems for the employer by stitching all these things together in a coordinated way, and solves that same problem for the user as well. Because to Paul's example, they don't have to wonder, what number do I call for MSK? What number do I call for mental health? How do I get a PCP? I just know that I have a relationship with this provider and with this care team, and they coordinate the care on my behalf. And as was alluded to previously, we believe the downstream savings from that, and frankly, the harder to quantify, but the impact on the investment of time and stuff what the employer makes is going to be significant as well, because it's going to happen in a fashion that's dramatically more coordinated than before.
Yeah. And so, Christopher, kind of back to your question on kind of the impact of primary care on kind of the networks, and maybe even the evolution to reference-based pricing. The way I think about that is, traditionally, employers have been a little conservative in wanting to offer some of these solutions because they're concerned about the impact to their employees. They're concerned about the noise at some of these things, the risk of doing this. There is comfort in the way we do things today with a traditional PPO and high copays and deductibles. There's a little bit of comfort in there. What we're starting to see is employers wanting to start taking some more risks, again, to impact that cost curve. So I think this hybrid approach that we're talking about, where the primary care, the care coordination is virtually wrapped with some of your traditional PPOs. So the My Virtual Care Access has 2 national partners there. So if an employee wants to go bricks and mortar, wants to kind of take their journey on themselves, they have that security of doing so. I do see kind of employers trending more in that direction of forcing employees to go more virtual first, forcing a little bit more of the get your care guided through a physician or an advocate to help you with that journey. The leap to reference-based pricing, I think, could be potentially another avenue of this. Again, I think it's a risk-reward aspect of it. The reference-based pricing organizations have become more adept at ensuring that noise and that confusion and that potential conflict can be avoided. So I do see it kind of as an evolution to get to that journey and come away from your standard bricks mortar traditional PPO networks.
Fantastic. Thanks, Paul. Thanks, Rob. Thanks, Janet. Maybe one last topic, and then there's a handful of other questions that we might just address here at the end from the participants. But the last question, this is for everyone, in any order, however you want to jump in. But as you think 3 to 5 years out, what would you expect to see in terms of adoption and impact from virtual care? What does the world look like 5 years from now?
Yeah, if you don't mind, I'll start here. I think certainly COVID has pushed everybody to more of a comfort level with receiving their care virtually, whether it's on their phone or their laptop. I do see a world where that is just the norm. That's where you get your care. Will there always be a reason to go to the hospital or get in-person care? Yes, but it'll be more coordinated through your phone and through virtually. Just as an example, I was having a conversation with somebody recently, and they were talking about the care that they receive and how they receive their care. They have some heart conditions, and they have several monitors that monitor the rhythm of their heart and some of the issues that they're dealing with. They have a cardiologist that they see maybe once a year in person, but the vast majority of their care is provided by Mayo Clinic in Minnesota. The physicians are monitoring the wearables, monitoring their care, and this person has never stepped foot in Mayo Clinic. So I can see a world where that's the type of care you're getting. Again, it's not, let me just look in the phone book or look in the provider directory and pick out a provider. It's more coordinated in getting the patients to, again, those best high quality providers.
I'll add sort of, Paul, a couple of things that you've said there, and then Christopher maybe answer your question, sort of where we see things in 3, 5, 10 years. back there, Paul, with reference just in terms of how people are thinking about, where do I get my care and acceptance of virtual care? I would even push that further to say that it's not just the acceptance that virtual care will be part of the model, but in that consumer research that Janet alluded to, and what we're seeing on the horizon is that consumers not just accept it, but they actually expect it. So as we make predictions for the future, I really envision a world where I sort of touched on this earlier, where you're no longer calling it virtual care. It's just the way in which I receive care. I think the same thing will be true about benefits. We won't need the moniker of virtual first health plan. It will just be the nature of a health plan product, and a consumer expects, yeah, this is where I go first. This is the front door that my carrier has built for me. And not only do I get the benefit of a lower price and better economics that come with that, but as a consumer in the world that we live in today, with all things being on demand and the experience that we've had through COVID with virtual care and so forth, it will be the expectation. So I think that there is a win-win there where, so many of those benefits accrue to, both the purchaser, to the user, and to the overall system. So I'm really excited to see, as much as we're driving the virtual care train here, I'm really excited to see, the elimination of some of those distinctions and live in a world, like I said, where it's just your health plan. It's just the care that you're receiving, because there has become such a seamless interaction between the two that the distinction is no longer necessary.
Yeah, business as usual. Janet,
I
what would
think
you add?
Yeah, maybe two other concepts I would add into all of it. And one, first around technology, and second around reimbursement. So, Rob, when you were talking very early on about how you view sort of the spectrum of virtual care, starting with text all the way to brick and mortar, I would actually add a stop to the left of text, which is just pure technology. And so even with text, you're interacting with a clinician, but there's a step even before that I think is growing more and more, where technology can replace the need for a clinician, or at least vastly supplement it and extend their reach. And then that has the ability to, help to lower costs and engage people in a different way. But then that points us to the reimbursement, because for all of the things that we're talking about today to really be able to transform how care is delivered in the US, which there is just incredible potential for it, the reimbursement system has to change. We talked with a health system recently who's actually pretty much at the forefront of virtual care, but still said, there's a lot we don't do because it's not worth the investment for us to do it, because we don't get paid for it. We get paid fee for service for the things that we do. And so to the extent that it helps us reduce the cost of delivering that service, we'll invest in it. But if it, extends, care, helps patients in between visits, that type of thing, right now the reimbursement doesn't support that. So sort of back to what we were talking about earlier, to me, the tipping point that will really change the trajectory, and something that employers should be pushing for with their health plans, is to move to value-based reimbursement, encourage, embracing all of those virtual care technologies and paying for it, and not paying for virtual care at 80 cents on the dollar, but really thinking about the full power that it can bring, and what's the value of that, and let's reimburse it that way.
Wonderful. Thanks, guys. Well, why don't we spend maybe just a couple of minutes on 2 or 3 quick hit questions that we've gotten, and then we'll wrap this up. So, Rob, maybe this first one is for you, which is, where are we on trusted technology capabilities for home provision of vitals? So wearables, blood pressure, heart rate, oxygen level, and also visual tools for examination. How does that play in?
Janet's comments there were a perfect segue into this, and we could have a whole discussion there again, sort of using that same notion of the different spectrum of options. We are, where to begin to distill this into 5-10 seconds, such a broad universe. I think it depends heavily first on, are you sending a physical device into the home, or are you still relying on something like AI or NLP, as I was alluding to previously. Obviously the device is being sent to the home, the pulse ox, the blood pressure monitor, like these are tried and true, tested, approved by the FDA, all that kind of good stuff. The improvements that obviously we're making there, that they are cellularly connected. There's no worrying about syncing Bluetooth or any of that kind of stuff. The members' data is flowing through such that we're getting billions of data points a year. Those are obviously wholly reliable. We're seeing improvements in those on a daily basis. As it relates to measuring pulse ox or blood pressure, any of those kinds of things remotely, an enormous amount of of progress and enormous amount of promise being made right now, but still very much, in the early innings of those. But really excited to see those continue to unfold and be rolled out, because that will only further, broaden the scope of what we're able to address, but also be able to obviously deliver things that much more efficiently in a lower cost fashion to the end consumers.
Terrific. Paul, this one, I don't know if that qualifies as a quick hit, but the question is, are insurance providers and their back-end systems ready for innovation and service delivery coming down the road? How do you think about answering that one?
You were breaking up a little bit there, Christopher. I think I got the majority of it. Are the insurance companies' back-end systems ready to take on innovation?
Yeah.
I would say they have to be, right? I don't think there's an option. As we said, that the market is moving in this direction. The employers group want innovation, they want solutions, and they want it integrated. To the example before around kind of whole person care and looking at different point solutions. How do these all work together? How do they interact together? How do you take the data from all these solutions and do something with it? Is it all integrated? So I think they need to evolve there. Now, again, this will be a promotion for using a third-party administrator like a Trustmark, where the one value of TPAs is flexibility. Our systems are flexible to plug and play with different organizations and kind of bring that data to the forefront. And so that's the value of the flexibility. But I do see health insurance organizations having to adapt to be able to be ready for this innovation.
I think it's true. And I think, we've said a couple of times, but it is all about the data, right? That drives the insights, that drives the value.
Yep.
Well, let's wrap it up there. Janet, Paul, Rob, thanks so much for your insights in the conversation. I found it really insightful and interesting, and I'm sure our participants did as well. Thanks everyone for joining. Bye-bye.
Thanks. Bye.
Thank you.